Hello everyone. Welcome back. MJ the coding coach. Today's video is going to be about E&M. As you guys know, for 2021, there are new E&M changes. E&M, evaluation and management. When you go to the physician's office to get seen by the doctor, when you go to the emergency room, if you have to do any observations overnight at the hospital, anything like that, that's E&M, evaluating and managing. So today, actually, I'm going to do a workshop on E&M mid-June. And I'm also going to drop more information about E&M as the workshop comes up. I also have a workshop that's coming up this Saturday for anesthesia. I will drop the link in the description box. I also have information about HCC coding, how to pass a pre-employment assessment exam, a lot of information about HCC. I had 2 workshops, one in March, one last Saturday on the 17th, this past Saturday. And I also have the audio, the video, the study guide, the cheat sheet with the most common used HCC codes, along with handouts as well for sale. I'll also drop that link in the description box as well. I hope you guys follow me on Instagram. If not, it's the coding coach _CPC. The coding coach _CPC. If you're not following me on Instagram, get over there. There's a lot of information on Instagram that you will want to have. So let's get into the video. So today's video is going to be about medical decision-making element definitions. So we also know, and if you don't know, I'm telling you now, one of the components into leveling the E&M to knowing which code to use, it depends on the medical decision-making. You have low decision-making, which means they don't do much to you. They check you out. They send you home. There's nothing we can do. We'll follow up in a couple of weeks. You may have moderate decision-making. When a doctor see you, then they might prescribe medications, things like that. And you have high complexity medical decision making. You might need surgery or something. It's an emergency or something going on, which makes it high complexity. So before you learn E&M, you have to know the definitions. You're not going to understand what you're reading if you don't know the definitions of what you're reading. So today I want to go through the medical decision making element definitions. And I have here some notes that I created because, of course, cannot remember everything. They know this. That's why they allow us to use the book on the exam, because they know we cannot remember all of this information. Let's get into it. The element of medical decision making for office and other outpatient services, I am going to go through this. One word you're going to see is problem. If you see the word problem, this is the definition. So I'm not going to say it every time I get to a word, this is the definition, and say the definition. So when I say the word, I'm automatically go into reading the definition. So when you're looking at medical charts, when you're getting into this new E&M stuff for 2021, you will know the exact definitions of what you're reading and understanding what's going on. So problem. A problem is a disease, condition, illness, injury, symptom, sign, finding, complaint, or other matter addressed at the encounter, with or without a diagnosis being established at the time of the encounter. To break that down, that's basically saying a problem is something or the reason, a sign, a symptom, a complaint, whatever the person is coming in to see the physician for. That's where we're going to consider a problem. Problem addressed. A problem is addressed or managed when it is evaluated or treated at the encounter by the physician or any other qualified healthcare professional that's reporting this service. This includes consideration of further testing. Let's say they come in, something's going on. You're having a headache, so let's do an MRI. Let's do a CAT scan. That's what they mean by further testing or treatment. Medications, maybe therapy or anything that may not be elected by virtue or risk. That's basically saying Whatever is going on, the problem addressed is us directly, or the physicians directly addressing whatever they coming in complaining about. Minimum problem. Now, keep in mind we're talking about medical decision making. So remember, we talked about low complexity, moderate complexity, and high complexity. So if it's notated that it's a minimum problem, a minimum problem is a problem that may not require the presence of the physician or other qualified healthcare professional, but the service is provided under the physician or other qualified healthcare professionals' supervision. And you can also see code 99211. Let's say the RN may see you, the LPN may see you, the medical lab tech or something like that. So a minimum problem is where the physician itself does not have to see you to address what's going on. Self-limited or minor problem. That's a problem that runs a definite and prescribed course. It's transit in nature and is not likely to permanently alter your health status. A minor problem or self-limited is saying that it might definitely run its course. Let's say maybe you have a little virus or something like that. So a stable chronic condition, a problem with an expected duration of at least a year. So if you have a stable chronic condition or a stable chronic illness, that's a problem that they expect to at least last a year or until the death of the patient. You're either going to have this at least a year or until you die. For the purpose of defining chronic conditions, they're treated as chronic whether or not stage or severity changes. You know, when we're coding, we're coded with severity. If it's mild, if it's moderate, is it severe, a chronic condition? They're saying here, from my notes that I took from AAPC and other resources, CMS, and things like that, so I can relate to you guys. The severity doesn't matter. If the chronic condition changed from minor to moderate to severe to recurrent or whatever, it's still classified as a chronic illness if it's expected to last over a year or until you die. Acute or uncomplicated illness or injury. A recent or new short-term problem with low risk or for which treatment is considered. There is a little to no risk or mortality with treatment, which means whatever treatment they're giving you for this acute uncomplicated illness or injury is not expected for you to die from it. And it's expected for you to fully recover without functional impairment. That means without any residual effects, without anything going on wrong with, once you fully recover. And that's the definition of acute uncomplicated illness or injury. And that's also, they classify this as a problem that is normally self-limited or minor, but is not resolving consistent with a definite and prescribed course, which means it's not a definite course. They can't say how long this is definitely going to last. An example of an acute uncomplicated illness can be like a simple sprain or allergic rhinitis. When you have nose issue, rhino means your nose. So let's talk about chronic illness with progression or side effects of treatment. This is a chronic illness that's acutely worsening, poorly controlled, or progressing with the intent to control progression and requiring additional supportive care, or requiring attention to treatment for side effects, but does not require consideration of hospital level of care. So a chronic illness with progression or side effects of treatment, it can progress, it can be poorly controlled, or it's worsening, but it does not usually require hospital care. So an undiagnosed new problem with uncertain prognosis. You're going to see there's a definition too in your medical decision making. And this is going to be a problem in the differential diagnosis that represents a condition that is likely to result in a high risk of morbidity without treatment, which means if you don't treat this, it's going to get worse. So an undiagnosed new problem with uncertain prognosis, which means I'm not certain what it's going to do. That's exactly what that means when it says with uncertain prognosis. I can't predict what this condition is going to do next. So they're saying it's going to likely result in a high risk if you don't treat it. An example of this may be a lump in your breast. So it could be cancer, could not be cancer, which means they don't know. Which means if you don't get it treated, if you don't check it out, it could cause some bigger issues, even leading to death. So acute illness with systemic symptoms. This is an illness that causes systemic symptoms and has a high risk for morbidity without treatment. We just talked about that in the last definition. So acute illness, we know acute is something sudden. So acute illness with systemic symptoms. This is an illness that causes systemic symptoms and has a high risk of morbidity if it's not treated. An example of this is like pneumonia. Acute uncomplicated injury. This is an injury which requires treatment that includes evaluation of body systems that are not directly part of the injured organ. So acute complicated injury. Again, this is an injury that requires treatment. The treatment that includes evaluation of other body parts that's not including what's injured. An example of this may be like a head injury with like brief loss of consciousness. So a chronic illness with severe progression or side effects of treatment. We talked about that earlier. We'll talk about it again. And we'll talk about exacerbation as well with this chronic illness with severe exacerbation. Just like you hear asthma with exacerbation. The severe exacerbation or progression of a chronic illness or severe side effects of treatment that have significant risk of morbidity and may require hospital level of care. Remember, we talked about chronic illness earlier, also that's not required for hospital level of care. Some chronic illness with severe exacerbation, progression, or side effects of treatments do require a level of hospital care. And of course, when you read the encounters and the notes and things like that, it'll let you know what's going on. So just a few more definitions so we can get you up to speed when we're talking about E&M for 2021. So tests are imaging, lab, pathology, physiological data, a clinical laboratory panel, something like a metabolic panel, and the differentiation between single or multiple unique tests is defined in accordance with the CPT code set. So test basically saying, of course, what it is, test. Any kind of imaging, pathology, physiological data, MRIs, CAT scans, X-rays, any kind of test, or, you can have diagnostic tests. You can have preventative screenings and tests. So, guys, where tests are. Okay, so independent interpretation. This is an individual like your parent, your guardian, your spouse, or witness or something who provides a history in addition to a history provided by the patient who is unable to provide a complete or reliable history. They may have dementia, they may have psychosis, you may have mental developmental issues. So when they have a independent interpretation, They're basically saying they're getting the history of the patient's medical issues from their spouse, whoever's coming to the doctor, a witness, a little bit from the patient itself. So morbidity. You keep hearing me say the word morbidity. So morbidity is a state of illness or functional impairment that is expected to be of substantial duration, which means last a long time. That's what substantial duration is. During which function is limited. You're limited to what you are doing. You're limited to the quality of life. And there is organ damage that may not be transit despite treatment, which means there might be some kind of organ damage. No matter what kind of treatment, it's not going to get better. So social determinants of health. When you're reading a medical chart, there's also going to be social determinants of health. There's going to be a section sometimes in your medical record, just like you have the HPI, you have the problem list, you have the assessment, you have the plan, you have the vitals, you have all of those components of the medical record. You have the PHQ, which is going to determine if the patient is depressed or not. You also have social determinants of health. And this is the economic and social conditions that influence the health of people and communities. Examples might include like food and housing insecurity. That's a social determinant of health. Because if they have food or housing issues, that can affect their health. So drug therapy requires intensive monitoring for toxicity. This is a drug that requires intensive monitoring. This is a therapeutic agent that has the potential to cause serious morbidity or death. That's why it has to be monitored. The monitoring is performed for assessment of these adverse effects and not primarily for assessment of the therapeutic efficiency. Basically saying, I'm not trying to see if this medicine is working good or not. I'm monitoring to make sure that you're not having any toxic effects from this medicine. So thank you so much for joining me. I wanted to go through some MDM elements, definitions. MDM as in medical decision making. We're going to get into E&M. A lot of people are asking for E&M videos since, as I stated in the beginning of the video, for 2021, there are new E&M guidelines this year. So again, thank you for joining me, the Coding Coach. Follow me on Facebook at Dynamic Billing and Coding Group. There's lots of information there if you're studying for your exam, if you're newly certified, or if you need to refresh your information. Dynamic Billing and Coding Group on Facebook. Again, on Instagram is going to be the Coding Coach CPC. That's where you can find me there. And I'm here on YouTube. You're already here. So in the description box, I will drop all of those links to the anesthesia coding workshop. I'll drop the link to the Instagram. I'll drop the link to the Facebook. I'll drop the link also to the HCC workshop study guide information. See you next time. Thank you so much for joining me on today's video about E&M and the new guidelines. Don't forget to like, comment, and subscribe. Also, hit that notification bell so you'll know when I drop these videos. Thank you. Bye.